Hello, my name is Dr.Goodkind, a board-certified plastic surgeon since 1984 and the owner and director of Fusion Medical Aesthetic Boutique. This is one of the many videos I have created where I briefly describe the salient points of the cosmetic surgeries I perform. Consider it a quick introduction to the surgical procedure, a start to your education process. It will stimulate thought and questions. It should, by no means, be interpreted as a substitute for a complete in-office consultation. The video is a simple presentation without diagrams, pictures, or other visual aids. I would encourage anyone interested after watching to navigate through my website, fusionct.com, look at the before and after examples of surgical and non-surgical procedures and the text, and then make an appointment for a complimentary, in-depth, personal, and private consultation. At that point, I and my team of aesthetic experts will be able to speak more specifically about your desires, your anatomy, and your expectations. We will then formulate a detailed plan personalized for you. I look forward to seeing you at Fusion in the very near future. Thank you very much. Now I'd like to talk to you about a rhytidectomy or face and neck lift. It's one of my favorite operations. Many people come saying, I just want my face done, I don't want my neck, I just want my neck done, I don't want my face done. Your face and your neck are connected. You can't significantly alter one without changing the other. That's not to say that you can concentrate more on the neck, but you still have to do some face, or you can concentrate more on the face and do little to the neck. The triad of facial aging is the deepening and lengthening of the nasolabial fold, jowl formation, and neck deformity due either to too much fat, too much skin, or muscle banding. There's a wafer-thin platysma muscle that goes from your jawline down to your clavicle, and for whatever reason, as we age, that inner edge of that platysma muscle shows up. So your neck problems can be one or two or a combination of all three things. It's important that I evaluate you and point out all of the things that are giving you your aged and tired look. I will obviously ask you what concerns you as well. Face and neck reconstruction or rejuvenation should not be a skin-only procedure. If we rely on the skin to rejuvenate our face, eliminating this fold, this jowl, and that neck problem, one, the result won't last very long, and two, it'll look very unnatural. It is imperative, I think, in most people, that we do a SMAS reinforcement and platysmoplasty. Those are two medical terms, which means the SMAS reinforcement is tightening up the covering of the muscle in the midface, which significantly decreases the length and depth of the nasolabial fold and takes this excess jowl tissue and brings it up to your midface. Secondly, a platysmoplasty is done through a small incision here where I can see and access those inner bands of the platysma muscle, and through here where I can access the muscle again. Once I see these bands, I can cut a little bit of them here, sew them together in the midline, and then sling them out underneath the skin so the muscle is tightened just below your ear. This results in a beautiful muscular trampoline of really nice tightening of the muscles. After doing both these procedures, we then retract your skin back superiorly and posteriorly, taking out all the excess, but allowing those wound edges to just beautifully touch without any tension. If we close your skin with significant tension, you'll get widened scars and you'll get unnatural bands in your face. This procedure is often done in conjunction with a brow lift or upper or lower lids. I'd say that within a week or two you will certainly look presentable. I would also tell you that if you're doing it in preparation for some sort of event where you'll be photographed or videotaped, You should do it 2 to 3 months ahead of time. There's minimal risk. It's minimally uncomfortable. You can do it, I prefer under general anesthetic, but if you insist, we can do it under local anesthetic. You probably only have to do it once in your lifetime, because now with the advent of facial fillers, as you age maybe 10 or 15 years after a nicely done facelift, you're more a candidate for fillers than a redo facelift. I think it's a beautiful operation, minimal to no scarring. You should look quite youthful, rested, and natural, such that you would feel comfortable going out at any time without makeup and not looking like you had an operation. I look forward to seeing you in the office. Look at the website, see all the before and afters. I'd love to give you a personalized consultation with regards to your concerns. Thank you.